Hi guys, welcome back to my YouTube channel Basic Knowledge of Human Anatomy. Today we are talking about the malformations. First of all, we'll talk about the neural tube defect, one of the earliest steps in the brain development in the formation of the neural tube, which gives rise to the ventricular system, brain and spinal cord. The partial failure or reversal of neural tube closure may lead to several malformations, each characterized by abnormalities involving neural tissue. The meninges and overlaying bone are soft tissue. Collectively, neural tube defect are the most frequent type of CNS malformation. The folate deficiency during the first trimester sharply increased the risk through uncertain mechanism and represent an important opportunity for prevention as administration of folate to women of the childbearing age reduce the incidence of the neural tube defect by up to 70%. The combination of imaging studies and maternal screening for elevated alpha fetoprotein has increased the early detection of the neural tube defect. Neural tube defect include the following. The most common defect involve the posterior end of the neural tube from which the spinal cord form. These can range from the asymptomatic bone defect, the spina bifida acuata, to spina bifida, a severe malformation consisting of a flat, disorganized segment of spinal cord associated with an overlaying meningeal outpouching. The myelomeningeal is an extension of the CNS tissue through a defect in the vertebral column that occur most commonly in the lumbosacral region. Patient commonly in lumbosacral region. Patient have the motor and sensory defect in the lower extremity and problem with the bowel and bladder control. The clinical problem derive from the abnormal spinal cord and often are compounded by infection extending from the thin or ulcerated overlaying skin. Encephaly is a malformation of the anterior end of the neural tube that lead to absence of the forebrain and the top of the skull. A varying amount of the posterior fossa structure may be present, and encephalocele is a diverticulum of the malformed CNS tissue extending through a defect in cranium. It most often involves the occipital region or the posterior fossa. When it occurs anteriorly, brain tissue may extend into the cyanosis. The forebrain malformations. The microencephalopathy describe the group of malformation in which the volume of the brain is too small. Usually, it is associated with a small head as microcephaly. It had a wide range of association, including chromosome abnormalities, fetal alcohol syndrome, and human immunodeficiency virus and Zika virus infection acquired in utero. The unifying feature is decreased generation of the neurons designed to cerebral cortex. During the early stages of the brain development, the progenitor cells proliferate in the subepidermal ventricular zone, the balance between the cell leaving the progenitor population to form the cortex and those remaining in proliferating pool affect the overall number of neuron and the glial cell generated. If two overall number of neuron and glial cell generated, it too many cells leave the progenitor pool prematurely. There is inadequate generation of the mature neuron, leading to the small brain malignancy and malignophaly. Excessive brain volume that is always associated with a large head and far less common and most associated with the rare genetic disorder. Related to all that, if you have any questions, you can ask it to me in the comment section. And if you are new to my YouTube channel, basic knowledge of human anatomy. Don't forget to subscribe it. Keep watching, keep supporting.